I'm Dr. Santanu Roy. I'm the pediatrician working in Hygiene Hospital. Today we'll discuss about really a burning problem, especially in rainy season, is a diarrhea in kids. The kids go out of the house, have a lot of food outside, and that might be the cause of diarrhea in kids. Now, what are the main causes of diarrhea? Normally, we find that most of the diarrheas in kids are mainly viral. So, unnecessary antibiotic use is not to be given. Many patients nowadays, I find that they start antibiotic at home or go to the normal chemist shop and buy medicines and give the kids. That's very harmful, and that will prevent the good flora of the gut to nurture. So, more antibiotics you give, the more floras goes down. So what we should do, we should manage the diarrhea with plenty of fluids. Whatever the fluid we lose, the fluid has to be replaced in case of diarrhea. That's the main dictum of the treatment. So either we give ORS or coconut water, and sometimes alternate with the plain water we should give, because the child may vomit ORS if you give frequently. So what we do, we give in small spells, either ORS or coconut water, alternate with plain water. So you should do that, and we should see the dehydration is maintaining or not. How we check that? By checking the number of urine output the baby is doing, the child is doing, and the skin turgor is very important. The capillary refilling time, by pulling the skin, what happens that if the skin returns very fast, that means there's no dehydration. If by pulling the skin goes slowly, that means dehydration is developing. Or we press the skin just like this and take it out and see how much the capillary refilling time is that. So if I found that it's prolonged, that means dehydration is developing, and then we have to give some fluids. Sometimes the child vomits along with diarrhea. That makes really a problematic, because we can't give the ORS by mouth. Then we require the child to get admit in the hospital and give IV drips. Very important to maintain the dehydration and the sodium potassium balance, because the vomit causes the sodium potassium losses and the loose stool. So we should monitor the sodium, potassium and the urea creatinine in a case of diarrhea or in a case of severe diarrhea. How long a diarrhea persists? Normally it persists for 2 to 3 days, and sometimes chronic diarrhea may persist even weeks. So you should be careful what we are dealing with. We're dealing with a normal acute diarrhea or we are dealing with a chronic diarrhea. Probiotics are given, that really helps. Curd and foods are good. Sometimes we should wean from our diarrhea case, that no milk and no wheat products initially, and then slowly we again start with the food, like fruit juice should be avoided, and some other food should be introduced slowly, like semi-solid foods we should introduce slowly, and low fiber diet should be given as on required when the gut accepts the food. So that is the main diarrheal thing. And the rice is a very good diet. If we can give fish, chicken, all those things that can be given, but rice is very good. Khichdi we can give in diarrhea, not an issue. We can give that. So carbs are important to absorb the water. So in case of diarrhea, not giving food is not at all logical. We should give fluids along with food. And the bottom line is that be observant, and the basic treatment is ORS. Thank you. Thanks a lot.